Arachnophobia, which is the fear of spiders. It's one of the most common phobias worldwide. People with arachnophobia can feel extreme anxiety or panic at the sight of a spider, even if it's just a picture. Spiders can be found almost everywhere, making this phobia particularly challenging. The fear often stems from an evolutionary response, as some spiders are venomous, though most are harmless. Treatment often involves exposure therapy, where individuals gradually and repeatedly face their fear in a controlled environment. This might start with looking at pictures of spiders, then progressing to seeing a spider in a cage, and eventually handling a spider. The goal is to reduce the fear response over time through repeated, controlled exposure. Next, we have acrophobia, which is the fear of heights. This fear can range from being uncomfortable on a ladder to experiencing panic on a tall building or a mountain. For some, even thinking about heights can trigger anxiety. This phobia can significantly impact daily life, making it difficult to enjoy activities like hiking, flying, or even working in certain professions. Cognitive behavioral therapy, or CBT, is often used to help manage this phobia by changing the thought patterns that lead to such intense fear. Patients learn to challenge their fearful thoughts and replace them with more rational ones. Virtual reality therapy is also becoming a popular treatment, allowing individuals to experience heights in a safe and controlled environment. Claustrophobia is the fear of confined spaces. Elevators, tunnels, and even crowded rooms can be a nightmare for someone with this phobia. Symptoms include sweating, increased heart rate, and a feeling of being trapped. Claustrophobia can make daily activities like riding in an elevator or taking public transportation very difficult. Some people with this phobia might go out of their way to avoid small spaces, which can limit their daily activities and opportunities. Like other phobias, exposure therapy and CBT are common treatments. Gradual exposure to confined spaces, along with relaxation techniques and mindfulness, can help reduce the fear response over time. Agoraphobia is often misunderstood. It's not just a fear of open spaces. It's a fear of being in situations where escape might be difficult or help wouldn't be available if things go wrong. This can lead to avoiding places like public transportation, shopping centers, or even leaving home altogether. People with agoraphobia might feel safe only at home or with a trusted person. This phobia can severely impact one's ability to work, socialize, and perform daily tasks. Treatment usually involves a combination of medication and therapy. CBT is particularly effective, helping individuals challenge their fears and gradually face the situations they avoid. Cynophobia is the fear of dogs. Despite dogs being known as man's best friend, those with cynophobia can find them incredibly frightening. The fear can be triggered by a past traumatic experience, such as being bitten or chased by a dog, or it can be learned from a parent or close family member. Gradual exposure to dogs and relaxation techniques are often used to help overcome this fear. This might start with looking at pictures of dogs, then progressing to being in the same room as a dog, and eventually petting a dog. The goal is to reduce the fear response through repeated, positive interactions with dogs. Ophidiophobia is the fear of snakes. This phobia can cause extreme reactions, even if the person knows the snake is harmless or non-venomous. The fear of snakes is thought to be an evolutionary response, as some snakes are venomous and pose a real danger. However, most snakes are harmless and play an important role in the ecosystem. Like other animal phobias, therapy and controlled exposure can help reduce the fear over time. This might involve looking at pictures of snakes, watching videos of snakes, and eventually being in the same room as a snake. The goal is to gradually reduce the fear response and increase comfort around snakes. Trypanophobia is the fear of needles, often making medical procedures extremely difficult for those who suffer from it. This can lead to avoiding necessary medical treatments, such as vaccinations, blood tests, and even dental procedures. The fear of needles can cause symptoms such as dizziness, fainting, rapid heartbeat, and extreme anxiety. Techniques like gradual exposure, relaxation methods, and CBT are used to help manage this fear. Gradual exposure might involve looking at pictures of needles, watching videos of injections, and eventually receiving a needle injection. The goal is to reduce the fear response through repeated, controlled exposure. Aerophobia is the fear of flying. This can prevent people from traveling by air and can significantly impact their lives. This phobia might stem from a fear of heights, fear of enclosed spaces, or fear of losing control. Symptoms can include sweating, trembling, rapid heartbeat, and even panic attacks. Aerophobia is often treated with exposure therapy, virtual reality simulations, and sometimes medication to help ease the anxiety. Virtual reality therapy allows individuals to experience a simulated flight in a controlled environment, which can help reduce the fear response over time. CBT can also help by challenging irrational fears and replacing them with more rational thoughts. Mysophobia is the fear of germs or dirt. often leading to obsessive cleaning and avoidance of potentially contaminated surfaces. This phobia can interfere with daily life and relationships, as individuals might go to great lengths to avoid germs, such as excessive hand washing, avoiding public places, and avoiding physical contact with others. Treatment typically involves CBT to address the compulsive behaviors and underlying anxiety. Exposure therapy might involve gradually reducing cleaning behaviors and facing situations that the individual avoids. The goal is to reduce the fear response and increase comfort with germs and dirt. Social phobia, or social anxiety disorder, is the fear of social situations and being judged or scrutinized by others. This can make everyday interactions, like going to work or school, extremely difficult. Symptoms can include blushing, sweating, trembling, and difficulty speaking. People with social phobia might avoid social situations altogether, which can lead to isolation and depression. CBT and medication are commonly used to help manage this phobia. CBT helps individuals challenge their fears and develop more positive thought patterns about social interactions. Social skills training and exposure therapy can also help increase confidence in social situations.